Hello, my name is Emily Durack and I attended work placement in the Prince of Wales Hospital in the bacteriology department. Going into the placement, I was under the assumption that bacteriology was a branch of microbiology that involved identification, classification, and characterization of various types of bacterial species. Although that is the basis for bacteriology, this placement altered my perspective to truly understand the role of a microbiologist in modern day society. Through the work experience program, I was tasked to assist the technical officers and technical assistants. This included preparing various patient samples by inoculating patient swabs onto the needed agar plate and preparation of various tissue, urine, and fecal samples for the identification of bacterial pathogens. The identification process included a mounting machine in which a sample of a suspected pathogenic organism was extracted and placed onto a metal plate which would be put into the mounting machine. The machine would utilize the unique density of crystallized proteins to determine the species of bacteria that was isolated via various peaks that proteins created. Through the data gathered with the various experiments, I also assisted the technical officers in identifying what antibiotic could be utilized to treat the patient. Through my role in the workplace, I have sharpened both my technical and interpersonal skills. Although the first week revolved predominantly on sharpening my technical skills, such as pipetting, streaking, gram staining, and inoculation through constant repetition, I also experienced difficulties perfecting my communication skills working in an unfamiliar environment. However, by the end of the week, I was able to advance my teamwork skills by working as a uniform team to finish all tasks that I was assigned under leadership. By the second week of the internship, I had slowly began to identify various organisms on agar plates and why certain tests were performed by understanding the selected media for each agar plate. For example, with eye swabs, a chocolate agar plate and an MSA plate are both utilized along with a gram stain. The gram stain provides an immediate preliminary assessment on the type of organism that the patient may have, while the chocolate agar plate and MSA plate incubated for 24 to 48 hours in CO2 and air respectively. The chocolate agar is an enriched growth medium that allows difficult organisms to grow that would not normally grow on horse blood agar, another enriched media, such as the Corynebacterium species. The MSA is a selective and differential medium that allows for the identification of mannitol fermenting staph species by the appearance of yellow colonies via an acidic byproduct. Both the Corynebacterium and Staphylococcus species are pathogenic organisms that can potentially leave a patient blind if not treated. By isolating the colony, it allows the mounting machine to positively identify the pathogenic organisms and permits the technical officers to test the susceptibilities of various antibiotics. However, if no organisms grew on the agar plates, but the gram stain identified gram-positive or gram-negative bacteria, the agar plates would be recultured. There could be a pathogenic organism hurting the patient that did not originally grow on the agar plates. To view the entire process of identifying pathogenic organisms confirmed why both agar plates and gram stains were utilized simultaneously, to maximize patient care and eliminate any potential errors. The third and fourth week included solidifying the knowledge gained by working at various benches assisting the technical assistants. As both the Legionella disease and coronavirus were being heavily tested in Sydney, particularly the Haymarket area next to the hospital I was interning, various tests for many patients were being performed. Working alongside the technical assistants and technical officers provided an insight into how patient samples were treated in a time of national crisis. Although there was an increase in pressure and demand from staff, each patient sample was handled with intense care to ensure absolutely no mistakes were made. Even a mislabel of an agar plate could have detrimental consequences to a patient, whether it is a test result being sent out to the wrong person or the wrong antibiotic prescribed, which could rise to antibiotic resistance. The skills and knowledge developed during the internship are thus transferable to any environment present and have most definitely prepared me for a future career as a bacteriologist. However, some self-improvement is always beneficial in the work environment. This includes more time management to ensure all assigned tasks are finished, achieving maximum punctuality regardless of public transport dilemmas, and implementing a flexible productivity system to maximize workflow efficiency. Throughout my internship, I have gained invaluable knowledge and experience and am thankful for the opportunity to strengthen my scientific knowledge and apply it to real-life situations. This internship has provided me with enormous advancement upon graduation over those who have not had this experience, as I have demonstrated that I can apply what is taught to me at university level into modern day practice. Although I did not see myself as a bacteriologist in the near future before starting this internship, this experience has opened my eyes to what being a bacteriologist means in today's society, an integral component in clinical diagnosis for patient care. Thank you.